Hello, I'm Margaret Thompson, founder of Richmond Family Magazine, and we are here today with Dr. Liv Gorla Schneider from the Pediatric Center. She is a frequent contributor to Richmond Family Magazine and a mother of three. And we wanted to check in with you today. Dr. Schneider, thank you for joining us.
Sure, thank you, Margaret, for having me. I appreciate it.
We wanted to talk a little bit today about some of the challenges that you are facing at the Pediatric Center and pediatricians in general. We've heard a lot of talk about families not wanting to come in for checkups and families not getting their vaccines as they should. So we just kind of wanted to touch base with you and have you chat with our followers and readers a little bit about kind of what you all are seeing at the Pediatric Center. What are the biggest challenges to providing good care that you are facing during this pandemic?
So I think, and first of all, I just think it's really important that we talk about kind of the fact that these challenges we're facing here in Richmond are really the challenges all parents and all pediatricians are facing around the country. And we're reading a lot, we're spending a lot of time understanding this new disease. It is a new disease. It seems to be very aggressive in adults, but thankfully it does seem to be sparing a lot of children from some of the more serious consequences. We do have some unique things we're finding in children, and so if you have any questions about whether or not your child has COVID, I just encourage you to call your doctor, reach out to them. We are here for you. And that is the main message I think we want to share with people is during this challenging time, we are here and we're ready to take your questions and be available to you. Besides learning about this new disease, which has taken a lot of time and a lot of resources, both nationally and individually in practices, we're also finding that parents are not coming in right now due to stay-at-home orders or stay safer at home orders for their routine care and routine vaccinations. And from the very beginning, that is the flag that we have had, that children are missing out on the regular care that's so important to making sure they stay safe from diseases and problems that we can prevent. So in addition to COVID-19 concerns, we have continuing the regular care that helps us keep kids safe and healthy.
Right, I've heard that. My sister-in-law, I think, said there was a measles outbreak in California because people weren't getting their measles vaccines, and that was something that I thought was gone. So kind of talk a little bit about what shots are the most critical for parents to make sure they get at the different ages.
So the AAP continues to be our main guidance for this. The American Academy of Pediatrics is in touch with us weekly. They have really prioritized children under 2. So for that 2-year checkup and below, they would like you to bring your children in routinely, just like you always do for the regularly scheduled shots. That includes newborn care, the 1-month, 2-month checkup, the 4- and 6-month checkup, and then at 9 months a year, 15 months, 18 months, and then 2. And the reason why that series is important because it builds on itself. So one shot is not enough. So even if you feel like, well, my 2-month-old got their vaccine, it really is important for them to have the 4- and 6-month shot to prevent pertussis, which is whooping cough. That is a vaccine preventable disease that even before this was on the rise. So you mentioned measles, and one of the things we know is that since April 2019 and April 2020, during a 4-month period, we've given 400,000 fewer measles vaccines in this country.
Wow.
What it's going to do is really increase the likelihood that children, even those who've had their measles vaccines, could be susceptible to this once completely preventable illness, still preventable illness. We just need to get kids into the office to get their vaccines.
Oh my God.
So that is a challenge that is really facing this country as a whole, and we need to make sure we don't pass on preventable illnesses due to concerns about COVID-19.
I would say. So how do we know, how do I know what shots my child needs right now?
So certainly if you've kept on track with your normal routine well check, then you should be up to date, but you can always call your pediatrician and ask them. It's a very easy record for us to pull. And then just remember the routine American Academy of Pediatrics schedule, and that's listed everywhere. Generally though, it's every 2 to 3 months your baby's first year of life, and then every year after. We also strongly recommend shots at 4 years, 11 years, and 16 years. And then a new addition to help keep your child on track is telemedicine. We are able to do a lot of telemedicine visits online now, including well visits, which insurance companies have recognized are important to make sure kids are on track with. So they are paying for those visits and facilitating conversations. So if you have questions about your child's sleep, your child's behavior during this pandemic, that is a great way to access your pediatrician is through telemedicine now.
Oh, that's great. We did a checkup on telemedicine not long ago, and it was really neat. It worked, and the doctor had us take temperature and weight and pulse rate here at home, and looked in his ears and down his throat through the, through the computer camera, and it totally worked. So
No, it doesn't, we will have to do some catch up, right? We're still gonna have to do a full physical exam. We'll have to do some catch up on some lab screenings. And for adolescents, it does pose a little bit of issue in terms of a confidential discussion. But for those school age kids in the 5 to 10 year range, it works great. The kids are engaged, the parents are engaged, and we can do those catch up pieces when we need to. What we don't wanna do is miss out on the essential building of good health that is really critical right now, given all the concerns that we have. Anxiety is higher, worry is higher, schedules are off, sleep schedules are off, nutrition's worse. And if we don't watch ourselves, this pandemic is going to lead to a pandemic of anxiety and healthful behaviors in kids, in addition to the more practical concerns about other preventable diseases that immunizations can prevent.
talking about anxiety, I know that your practice and other practices around the country are starting to add psychologists to their practice, to the staff. Is that an area that they've also been able to operate through telemedicine? Are they doing
Absolutely. So pretty much all psychologists are now operating completely through telemedicine. There are certain circumstances where that's not as feasible, but almost all telehealth, telemental health has moved to online. In a time when so many doctors' offices are seeing few patients come in, telemental health is just exploding. We do have a full-time psychologist available to us, and that's been a wonderful resource, not only for patients who see her, but also to provide us with referral basis to other community resources. We are getting ready to make another announcement. We found the program so effective that we're really excited about where things are moving in that department. So those are needs that we have that kids and parents really should be able to access through their pediatrician more regularly in the very near future. That's the trend that's coming up in pediatrics for sure.
That's wonderful. I can say that our families personally use Dr. Islam in your practice. That is why we switched to your practice, just for Dr. Islam. We've loved all of the pediatricians, but we switched just for her, and we've been so happy with her. She's wonderful.
I'm glad. She is wonderful. We're very, very lucky to have her.
Yes. Well, thank you, Dr. Schneider, for taking time out of your busy day to talk with us today. We really appreciate it, and we hope that everyone heeds the advice and keeps your vaccines up to date and keeps those well checkups.
Thank you so much. Appreciate you giving me an opportunity to speak with you. Take care.
Have a good day.
Bye-bye.
Bye.